Hello everyone, I am Dr. 𝗓𝐧𝐫𝐞. I am the general medicine educator. So in this session, I'll be doing the quick discussion of multiple choice questions on the topic of the envenomation. So the first question is, a patient presented with suspected envenoming requires a rapid but careful and targeted assessment to determine if envenoming is present and what urgent responses are required. Which is the most first response in ensuring a good outcome? The options are check for breathing and circulatory problems and institute cardiopulmonary resuscitation if indicated, first option. Second option, give antivenom. Third option, if the animal that caused the bite or sting is available, try and identify it so that likely risks can be determined and targeted treatment is provided. Fourth option, insert an IV line and consider an early IV fluid load. Fifth option, urgently examine for signs of developing neurotoxic flaccid paralysis and bleeding tendency secondary to coagulopathy. Now, so in a patient with envenomation, what is very important first to be taken care is the checking the airway breathing circulation, right? So ABC is very important, and you need to institute the cardiopulmonary resuscitation if indicated. And why not the other options? Let me take up one by one. So you take the antivenom. Second option. Option B might seem likely an obvious answer, but not every patient bitten or stung by a venomous animal will develop medically significant envenoming. Therefore, not every patient needs antivenom. So second option, it is incorrect. Next, what about the other options, C, D, E? So option C, D, E are all necessary urgent requirements in managing the patient with suspected envenoming, but ensuring there is no problem with the classic airway breathing circulation and treating any problems found is the most urgent action. So definitely all these three are also required. But before all these three, what is very much required is checking for the breathing circulatory problems. That is what is very important. And after doing the assessment of the airway breathing circulation, then you can follow the remaining parameters. Okay, the first important is checking for breathing and circulatory problems and institute CPR if indicated. Then coming on to the second question. A 32-year-old man presents to you with a history of working in a rice paddy and being bitten by something which is not seen by the patient. He appears unwell and has swelling around the bite on his foot with 2 bite marks that are bleeding. What is a key test that might help you determine the type of snake and need for antivenom? The options are 20-minute whole blood clotting test, arterial blood gas, blood pressure, extended coagulation studies, serum electrolytes. So here the correct answer is the 20-minute whole blood clotting test. See, a number of snakes might cause rapid envenoming with development of the coagulopathy, right? With development of the coagulopathy that can present as prolonged bleeding from the bite site. Any other recent wound or gums? What is this patient presenting with? This particular patient presenting with swelling, 2 bite marks, and as well as bleeding. So suspicion of the coagulopathy. So 20-minute whole blood clotting is a rapid and simple test that can provide useful guide to the presence of the snake bite coagulopathy, right? And this will in turn can help in determining what type of snake may be involved, and if there are several different antivenoms available, which one to consider can be made out by your 20-minute whole blood clotting test. Now what about the other options? Like for example, you take the blood pressure. That is certainly an important test, but an abnormal result is not specific marker for envenoming. That means if there is hypotension or hypertension or normal blood pressure, that will not be a specific marker for envenoming, but otherwise it's an important test. Now, what about the arterial blood gas analysis? Arterial blood gas is not a critical test in initial assessment of snake bite if there is a coagulopathy. Why? Insertion of the needle while doing, right? The insertion of needle while doing the ABG or a line may pose significant risk for the patient. So that is the reason why doing the ABG is not correct in this scenario. Now you take the other options, the extended coagulation studies and as well as the serum electrolytes. So serum electrolytes and as well as the extended coagulation studies may be useful but not critical to initial assessment, and it may be hard to obtain in a rural hospital setting, right? Both the extended coagulation studies, serum electrolytes, they are not critical in case of the initial assessment. But what is very important in the initial assessment is the 20-minute whole blood clotting test. So that is about the second question. So where is this particular patient working in? The patient is working in the paddy fields. That means they are like wet fields. Now we will move on to the third question. Right. Considering the patient in the above question, if we knew he came from somewhere in India or Sri Lanka, given the particular circumstances of this bite and that testing showed a coagulopathy, which of the following venomous animal would be most likely as a cause for this bite? For his bite: cobra, Indian red scorpion, crate, Russell's viper, saw-scaled viper. So what exactly the history tells us? The history tells he was bitten in the paddy field. So like the paddy field, they are like wetlands, wet agriculture areas. In this wet agriculture area, a classical setting for Russell's viper, right? So the answer is the Russell's viper. And this snake causes coagulopathy plus other effects also, right? And Russell's viper, another very, very important point is not only coagulopathy, it will also cause the acute renal failure. Now, what about the saw-scaled viper? Even saw-scaled viper also cause coagulopathy but tend to inhabit the dry areas, whereas our patient, right, why our patient was working in the paddy field, which is like completely the wet area. So that is the reason why the answer is the Russell's viper. And what about the other options? That is the cobra, it do not cause the coagulopathy. And even your cobra, the Indian red scorpion and as well as crate, all of these, they do not cause the coagulopathy. So that is the reason why your ABC is not the answer. The answer is the Russell's viper because the patient is working in a wet fields. Now coming to the fourth question. Our patient in the above question is clearly envenomed and needs antivenom urgently. In giving him antivenom, which is the most important drug to have available? Adrenaline, antihistamine, dopamine, hydrocortisone, prazosin. So the answer in this question is the adrenaline. The greatest risk when giving antivenom is the anaphylactic reaction. Right? So anaphylactic reaction, if it not correctly managed, that will be very much fatal. So managing anaphylaxis requires a multifaceted approach, but the key drug is what? That is adrenaline, in most instances administered intramuscularly, right? Intramuscularly. And adrenaline should always be immediately available in an appropriate dose prior to giving any antivenom. That is very, very important. And what about the other options like hydrocortisone and as well as the antihistamine have also been suggested as the pre-medications prior to giving antivenom, but the clinical trial evidence does not support their use, right? They are also required, but the clinical trial evidence does not support their use. And what about the prazosin? Prazosin, in the past, it has been recommended treatment for envenoming by the Indian red scorpion, right? So if it is the Indian red scorpion, the envenoming, then prazosin, that was very much required. But the more recent clinical trial evidence indicates that specific antivenom is more effective. So the prazosin was previously recommended for this Indian red scorpion. Now, what about the dopamine? Dopamine might be required in managing intractable hypotension. So, if the patient is having severe form of hypotension, dopamine is required. But it is not an alternative to adrenaline as the drug of first choice in treating anaphylaxis. So, our main aim is to prevent the anaphylaxis, for which you need to keep the adrenaline ready. So, that was the answer A. And coming on to the last question of the session, the patient in the above question has now developed a low urine output, right? Developed low urine output despite adequate IV fluids. In this small rural hospital setting, what test might help in deciding that acute kidney injury and renal failure is occurring? The options are dipstick test for proteinuria, measure serum creatinine level, none of the above, renal biopsy, renal ultrasound. The answer in this question is the dipstick test for proteinuria. So, in this setting, it is likely that simple urine dipstick test will be available, and if this shows proteinuria, right, if this shows proteinuria in this clinical condition, it is very likely the patient is developing renal failure. A serum creatinine level may certainly help, right? The serum creatinine will certainly help, but if available, it may take time to gain an answer. So that is the reason why, rather than your serum creatinine level, the preferred will be the urine dipstick test. And what about the other options? The renal ultrasound is unlikely to be available and may not assist in the diagnosis. It will not give you any particular diagnosis. Only it can tell you post-renal type of acute renal failure. But pre-renal and as well as intrinsic renal, we cannot make out immediately by renal ultrasound. Renal biopsy. Renal biopsy is inappropriate given the active coagulopathy, because the question is about like the above patient. The above patient had the coagulopathy by your Russell swiper. So renal biopsy is inappropriate in this question. Okay, so these are some of the questions related to your envenomation, and tomorrow again I will come up with few more questions on the same topic of the envenomation. Thank you very much.